Thank you very much, Kathy, and thank you very much also to Professor Stephen Dovers and the organisers of this wonderful evening for the opportunity to speak to you this evening. As Kathy said, I've spent most of my career doing field work in regional countries, and these have been quite diverse. So my topic this evening is looking at vulnerable groups, youth, gender issues, the aged, and the impact of natural disasters on them. In looking around some of the databases and the governance context, policy context, and so on over the last few years, it's pretty clear that disasters have an asymmetrical impact on females, young people, and the elderly, particularly in terms of mortalities, morbidities, etc., but also in the reconstruction of livelihoods, where often these groups are left to fend for themselves. So I come to the conclusion, really, that DRR policy for vulnerable groups needs to change significantly. In the 2004 report to the World Bank by Benson and Clay, they showed empirically that $1 spent in preparedness before an event saves actually $4 in relief and recovery. So that's a significant economic issue to take into account by all authorities, I think, up and down the chain of governance when looking at how best to approach getting better outcomes in terms of disaster risk reduction. Some of the forerunners and pioneers of this strand of issues I'm looking at, this Fothergill, Fordham, Ennison, etc., called attention to this gendered terrain of disaster long ago, but very little has actually been done about it. There's a lot of attention to gender mainstreaming and those issues in the UN level documents, but all the main disaster databases only give us global level data, national level total mortalities, morbidities, estimated costs, etc. And we can't get down to actual household level or impact on individuals. So these global level databases are actually of very little use to demographers and social researchers, and hence we need to rely on national censuses and fertility surveys, but most importantly on the small-scale surveys of individual researchers. Here's a bird's eye view of some of the mega disasters and mortalities in Asia since the 1991 cyclone. And I'd have to say that some of the international efforts since that event in 1991 have resulted in considerable reduction in mortalities in Bangladesh and along the Orissa coast, which is quite timely because today we have an event on in Orissa which has resulted in a small number of mortalities, nothing like the 10,000 back in about 1999. And this is really a function of better preparedness, evacuation techniques, provision of more evacuation shelters, but also psychosocial attention to what makes people go to evacuation shelters when there is an event. Now, data from MDAT shows that actually floods and windstorms figure as the largest number of events in Asia, even though tsunamis and earthquakes usually bring about the largest numbers of mortalities. And you can clearly see that the Asia-Pacific is the geographical region which hosts not just the largest numbers in terms of population, but the largest numbers of natural disasters. And this is probably a function of varied governance regimes, what I would call poor governance, often poor leadership, various cultural issues, large numbers of people in the path of disasters of all types, but also extreme poverty levels in many areas. And these types of large-scale mortalities have significant social and cultural effects in terms of these aspects of people's lives. Groups of people most at risk are, of course, women, children, the elderly, the disabled. There's very little attention to people with disabilities in the disaster literature or research. And this is really a very under-researched area. And people from minority groups, those from different cultural backgrounds. Poverty increases the risk factors significantly. In much of the literature that's coming out, we now look at disasters as catalysts for change, and in the context excuse me, of the Build Back Better transformative principle, which is arising from the Hyogo post-2015 framework discussions. We're hoping that that framework will provide an opportunity for the integration of principles of sustainable development with mitigation of the impacts of climate change, and to be able to look towards a future where we can integrate 4 research communities. That's climate change, development, disasters and poverty alleviation, because all of these issues really are multidimensional and multidisciplinary. Looking at the people-centred approach arising from that international framework, it's not really a dichotomous issue, I don't think. It's not one where you can say people-centred versus engineering-centred, but often the two go together, because in infrastructure loss terms, where there is either no infrastructure, as down the Burmese Delta, or poor infrastructure, as in the Sichuan earthquake, then this in turn can lead to increased mortalities and difficulties with post-disaster reconstruction. So I'm hoping that we can move from a situation of disastrous failed development to one where we can address some of these issues in a multidimensional way. So just very briefly, there's definitions of resilience coming out of the international literature and vulnerability, and I do a lot of my work around those definitions. I find Norris's framework from 2008, which looks at resilience as metaphor, theory, strategy, and a framework for transformation, very useful. She and her colleagues look at the 4 networked sets of resources. Economic development obviously alludes to the poverty measures. Social capital, the community networks, which can help at all phases of disaster experience. Information and communication, because that helps communities to prepare better and also to be able to recover. And the community competence issue relates to leadership and interconnecting networks of social capital. So if we are to achieve that positive trajectory in the reconstruction phase, taking an analytical framework which looks at those 4 interlinked resources can be quite helpful. Females in Asian disasters have figured disproportionately, as some of these figures will show you. In the Asian tsunami, overall, Oxfam showed that around 75% of mortalities were female. In parts of Aceh, it rose to 80%. In the Burmese cyclone of 2008, 61% of mortalities were female. In the 10 most seriously impacted townships down the Burmese Delta, 26% of mortalities in the key productive age groups from 18 up to 60 were females. So this type of asymmetrical impact can have serious and long-lasting effects in developing country societies. This graph gives you sort of a bird's eye view of those comparative losses in age terms. It also draws out some differences that we notice between the Burmese situation and the traditional U-shaped curve in other disaster events. Normally, you would see most losses in the very young and the elderly over 60, but in the Burmese case, it was in those key productive years, and with a disproportional impact on females. So a few just overview images from the most seriously impacted areas in Aceh from the 2004 event. You can see 2/3 of mortalities in the survey by Rofi, Ducey and Robertson related to females. The most extreme impact was on coastal communities, particularly fishing communities. And this also was the same in the Burmese Delta, where 80,000 out of 140,000 in terms of losses occurred in 2 townships, Laputa and Bogalay, both of which were coastal fishing communities. And in Laputa, all 20,000 salt workers and all of their families died when that storm surge of 7 metres rolled across the delta. So that meant that industries down the delta have also changed. The salt industry has never recovered. People don't want to work in it. They work in different types of employment instead. A quick image of female losses in these villages in Aceh. Aceh Bazaar was one of the areas most seriously impacted. And you can see in Kampong Baru, 39 surviving females out of a pre-tsunami population of 242. And in Munasab Masjid, only 45 from 1,110 pre-population figures. Now, these are very significant losses. Some of the reasons for those losses are cultural, of course, where women might be down at the coast waiting for their fishermen husbands to return. Their long clothing inhibits them escaping. They haven't been taught to swim for modesty reasons. They can't climb trees often because they're trying to hang on to young children, and so on. So with relation to Sri Lanka, which was the second most impacted area from the tsunami, you can see that kind of pattern still continues, with 65% of mortalities in Gala being female and 56% in Batticaloa. These two were 2 of the most severely impacted towns in Sri Lanka. And again, it was cultural issues and types of employment amongst the fishing communities which really added to those results. This chart shows you the typical U-shaped pattern, which most deaths normally being amongst the very young and the elderly, and this is taken just from Batticaloa. Taiwan, the Chi earthquake, it's a little bit different. You can see male and female across most age groups. There's not very much difference, but most deaths did occur in the over 70, over 75 age groups. And you might expect that with an earthquake because of the different types of building materials that are involved. It's a different situation from a hydrological event or an event where most houses are built of flimsy palm leaf type materials. This chart gives you a better picture, I think, of the severe upturn in deaths amongst the elderly, but the gender differentials are not very great in that event. And this may also be a function of better resourced communities where poverty was not so widespread and so on, and perhaps better governance in the Taiwan situation. Lowe, in analysing that event, looked particularly at things like gender and education and the occurrence of post-traumatic stress disorder. She said victims were 1.46 times more likely than non-victims to commit suicide, and the critical time period seems to be 2 to 15 months after the disaster. And this equates fairly closely to the situation after the Kobe earthquake in 1995. The elderly, I'm looking particularly at some results from analysis of data on the elderly. The Bam earthquake in Iran Their cultural issues meant that survivors, often on their own, had very difficult time. They were disadvantaged in obtaining relief assistance, both material and health services. Relief and medical services providers didn't take into account their pre-existing health status and their functional capacity when delivering services. And this type of impact is also found down the Burmese Delta from a survey by Help Age International. It looked at survivors in the towns of Bogalay, Doktan, Laputa, etc., and found that most elderly survivors were very frail, often without any family members around them, and wondering how they were going to rebuild their livelihoods. Just turning to look at a comparison of the impact of ageing in Japan with the 1995 Kobe or Great Hanshin-Awaji earthquake compared to the 2011 earthquake and tsunami in East Japan. And you can see the red lines, those over 60 in the 2011 event were significantly higher. So the impact of an ageing society in Japan has really complicated the recovery process from the 2011 event. Almost ready? This again is just a chart showing the differences in the ageing from Hyogo and Tohoku. With the 2011 event, we have an extra factor to consider, and those three prefectures, Iwate, Miyagi, Fukushima, there has been significant depopulation, out-migration of young people over the last 20 years. It's totally different to the Kobe situation, where the government implemented an urban renewal program and attracted young people to come back into Kobe to help rebuild it. But in these three prefectures, the recovery will be much longer, much more difficult, because that ageing population doesn't have the young people to help rebuild, and from what I'm told, there is very little chance of attracting an urban renewal program or young people to move back into that area. So I'll stop there, and thank you very much for your attention.